and welcome to our monthly talks that starts today with mental health. I am Reem, the director of B Psychology Center, and here with me is Ross Addison, who is the consultant CBT therapist at B Psychology Center. So today we'll start our talk with tackling what is mental health and why is it important. First of all, mental health is basically our psychological, emotional, and social well-being. It affects the way we think, behave, and feel on a daily basis. It also affects how we relate to others and respond to stress, and also how we take actions every day. Ross, tell me about why it's important for children to maintain a mental health well-being.
I think for children and adults alike, it's really important to be able to feel like you have some level of contentment and pleasure and happiness throughout your life. I think with children, some of the time it's very preventative type of work. And knowing that many children or that many mental health concerns typically start by the age of 14. So experiences in young people up to the age of 14 accounts for about half of all mental health concerns that emerge in adulthood. So I think tackling mental health concerns early, making sure that children feel supported and have the necessary skills and techniques to be able to self-manage the things that life throws at them, so that when they do become adults, they feel like they're equipped to be able to deal with all of the types of stresses that we and everyone has to deal with themselves anyway.
What are mainly the mental health concerns that you see with children and adolescents?
Typically, it's anxiety disorders and mood kind of difficulties / depression. I think typically for anyone under the age of 10 or 11, it tends to be a lot of separation anxiety traits. So that would be characterized by concerns around safety or security of themselves or of their loved ones. But that doesn't mean they couldn't experience panic attacks as well or panic symptoms. I think after the age of perhaps 10, 11, 12, there's a lot more social anxiety traits that emerge. Social anxiety being fears of judgment, humiliation, rejection and embarrassment. Things like worrying about disappointing people or yourself. This probably accounts for a really large part of the children that I work with. So from the age of 11 up till 18, 19, social anxiety is probably one of the key concerns that they present with, as well as perhaps some other comorbid anxieties as well. Things like panic or maybe fears, phobias, or perhaps even OCD traits.
Do you think that the anxiety disorders have increased in today's adolescent generation?
Well, I think in terms of the statistics, it would point that way, that it is increasing and it's on an upward trend. I think more and more people now are developing anxiety-based concerns and depressive concerns as well. I think partly we've got better at identifying it and reaching out and seeking support. But I think when I think about how much easier it perhaps was when I was 14 or 15, like the amount of information I had to hold in my head was actually less than what young people have to now. I think I got my first mobile phone when I was 16 or 17 or something, and that was a really new thing when I was around. That was, 20 years ago. The internet wasn't really available. I think the amount of web pages that are available were really restricted. It wasn't big. And we didn't have social media. It wasn't there. So I think nowadays there's a lot more that young people have to navigate. In terms of just navigating their daily life and daily functioning, there's just a lot more that they have to do and they have to consider, as well as all the things that we had to consider. Friendships, academics, family, pets, all the things that we had to kind of challenge and work through as young people. I just think there's more to deal with now.
Yes.
I think that's a pretty key part of why we're seeing this upward trend of people developing not only anxiety, but depressive traits too, and other mental health concerns. It's difficult stuff.
Yeah, I'm glad I'm not growing up at this age.
I think it's really hard for parents. I think parenting nowadays has taken a very different form than it used to. I think there's a lot more that parents have to consider and have to think about and upskill themselves on. I think when I sometimes speak to my mum about what I was like as a young person, the methods that she would use were probably quite simple in terms of it was very much kind of discipline and I responded. Nowadays, it's not as easy as that. There's so much more that young people have to contend with in daily life that it's not as straightforward as discipline or consequence and reward. There's more the parents have to do.
What would be your recommendations for parents in order to promote their children's mental health well-being?
I think I would imagine you'd agree with this, that it's not only people with mental health concerns that go and see a psychologist or a therapist. And we don't advocate that it should only be those people. Like anyone can go, and I think even just knowing that you have a space to be able to vent, to talk, to process, is really important just for anyone on the planet. But I think for parents in that sense, I'd probably be recommending that they do some parenting courses. Make sure they're reading up, make sure they're reading books, understanding the influence of technology on young people, for example. I think we're certainly in the UK, we're seeing a trend of more sexualized behaviors a little bit earlier on than previously. Maybe 20 or 30 years ago, it was a little bit more delayed, let's say. Nowadays, young people are engaging in sexual activity a little bit earlier. That can be a challenge for any parent, because when you're not expecting your child to perhaps even have a girlfriend before the age of 16, 17 or 18, and suddenly they're at school and they've got a girlfriend and they're going to the cinema and socializing when they're 12 or 13, it's just a big shift in parenting.
Yes.
So I think equipping yourself with parenting classes, doing lots of reading, parenting forums, I'd really advocate that they just try and upskill themselves in kind of 2019.
Okay. What about with schools? How do you think they can promote a better mental health being for the kids?
I can speak about Dubai in particular. I think schools here do a lot.
I think they do.
I think they're really good at creating groups. So primary school age children, for example, they have lots of circle time groups, which is where they maybe collect a few vulnerable young people, anxiety or confidence or self-esteem, and they have a weekly or even 2-time weekly kind of little group on the floor session where they just talk about feelings and emotions. I think this is something that a lot of primary schools here do and is really helpful for that targeted audience. I think they do a lot of talks and encourage outside agencies like ourselves to come in and do mental health talks in terms of the promotion. I think many schools here have inclusion teams, so they have their school counsellors in-house who provide absolutely stellar work to the young people. So I think schools here really do a lot in terms of promoting and offering the support in the school. And they know that there are services out there like ourselves that they can refer to as well for maybe more challenging or more clinical cases. So I think they do a lot here.
Yes. No, I've seen that. They definitely do a lot. I'm thinking about also in workplaces, what could be done in order to promote mental health well-being. And I've been asked about that a lot. And first of all, I think encouraging a culture where employees can come out and talk about their mental health struggles without feeling ashamed or without feeling like they can not necessarily be fired, but stigmatized for it is something that's very important. The other thing is recognizing that employees are different. So one thing that would motivate one person would actually stress another person. So that's another thing to keep in mind constantly. Also.
Sorry, do you see the organizations that you work with?
Yes.
Do you see that they're encouraging, organizational change to kind of implement and encourage openness around mental health?
You see it starting recently. In the past couple of years, I'll speak again of Dubai. Yes, you see it starting, and you see that they are leaning more towards that, and they're recognizing the importance of having a culture that supports mental health well-being.
Yeah.
Because otherwise, their employees are suffering, hence their productivity is suffering.
Yeah.
So that's also something that's moving forward here in Dubai, definitely.
I think more typically, I think they tend to employ organizational psychologists to do some of this work.
Yes.
So, supporting kind of employees to manage life stresses or work stresses. they provide those counselling opportunities within house. But I think I've seen in Dubai, like you say, more of a trend of them encouraging clinics or agencies to come in and just even do talks.
Yes.
Just to open up the topic. I know some companies have their own screening tools as well. I think maybe some of the larger companies, and maybe, I can't say, I can only think of a few, larger companies that are a little bit more on board with promoting positive mental health and being open to talk about it. And if you go to your HR representative, there's not a stigma or a feeling that information is going to be dispersed to the rest of the organization. So it feels like privacy and confidentiality is an important part of companies being able to offer this kind of support to their employees.
There's also a trend of inviting clinics to do talks on specific topics. So how to handle stress, how to eat in a healthier way, how to avoid emotional eating. So all the aspects that would promote somewhat of a healthy environment for the employees to work on. And that trend has been starting and it's picking up with a lot of companies and organizations.
Oh, good.
Yeah. How do you think employees would respond to an initiative like that?
I think as individuals, perhaps not thinking of them such as employees, but as individuals, I think they would benefit from it and I think they would appreciate it. As employees, I think it's still so difficult to talk about mental health, even with colleagues. And mental health in the sense of problematic mental health. So I think forward-thinking companies will be implementing more mental health strategies, but I think it's to really encourage and facilitate long-term change. I think it will take a long time, but you have to start somewhere and you have to get moving with it.
Yes, I believe that as the trust grows between the employees and they actually see that this is a belief, this is not just something that's out there for advertisement, that it would encourage more and more employees to come forward with their struggles. Because you see in a lot of situations, I've been told by clients definitely that, I'm scared to say that I'm struggling with a mental health issue, but if I had diabetes or cancer or anything, any physical disease, I'll come forward with it and I have no problem. So it's also the way the society views, the stigma of the society is still embedded within the individuals, even though the companies could be taking those steps forward.
I do think also that if employees saw positive outcomes, so for example, that the HR representative or the agency that perhaps they brought in to discuss mental health or to provide even one-to-one support, if it was successful in that they felt that the service was influential and it helped them, and that created a culture of being able to talk a little bit more openly about the positivity and the necessity of being able to reach out to someone, I would imagine that kind of positive talk amongst employees may encourage them to feel like they can go and ask for help and support.
Yes, I totally agree. So as we are ending this, our first talk, anything else that you would like to add? Plenty,
but I think sometimes it's better to save it and to make sure it's a specific thing that we're talking about for people to really get involved with it.
Okay, so tune and subscribe to our channels and wait for more videos of me and Ross talking about various mental health issues and concerns.
And as always, let us know if there's any other topics that you'd like us to talk about, or if you have any comments or questions about what we spoke about today. Thank you very much.